mute it as soon as it comes. Otherwise, no, not here, not here, on the YouTube. It's muted already.
You ready?
I think you're live. Let's go.
Wait, I like to have the Zoom up instead.
Yeah. Here, yeah.
Now we're here.
Ready?
Whenever you are.
Hi, guys. Thanks for joining. This is Essence of Medicine. Today, we have a guest with us, Dr. Jacob Varrone. He's a plastic surgeon in Houston. And today, we're going to be talking about the life surgeon journey.
I'm Dr. Abbasi for Essence, and this is one of our podcasts where we have had in the past, and it's my pleasure to have actually Dr. Jacob Varrone, a very experienced, very proliferative plastic surgeon in Houston, and his life and his work reflect life and experience of lots of surgeons, my generation and his generation. And without further ado, I would like to Dr. Varrone introduce himself and explain and tell us about, how he started getting into medicine. Please, Dr. Varrone, tell us a little about yourself. Who are you, and what got you in medicine?
Well, thank you so much first for the opportunity of being here and to have the opportunity to spend the time with you. And it has been an amazing experience and a very wonderful day to see surgeries that I don't see normally, such as spine surgery. So it was a great day. But going back to my story, since I was a little boy, my parents always told me that when I wanted to do or get some new toys or whatever, essentially it was something related to medicine, like a first aid kit and things like that. When I was growing up and with the associations similar like the Boy Scouts, also I wanted to be in the first aid section because that's what I really like. And then I decided to go to medical school, which I enjoyed tremendously. And I was focused on being a gynecologist or a pediatrician. Then I opened the eyes to reality and I said, well, why? I mean, why gynecology? Why pediatrics when you have a passion for other things? And I love art and I love sculptures and I play piano. And I said, well, if I like surgery and I do all these things, maybe plastic surgery will be the option.
May I ask where you went to med school?
I went to medical school in Mexico City in the National University of Mexico. Then I moved to Houston when I finished medical school. And I started general surgery in Baylor College of Medicine.
Mm-hmm.
Then I did plastic surgery at Baylor College of
Wow,
Medicine.
very prestigious.
And then I did 1 year of microsurgery at Baylor too.
Mm-hmm.
When I finished, I became part of the staff there because one of my professors invited me to be his partner. So I was with him for a while. And then in a very amicable way, we decided that it was better for me to, he was getting a little older. So he said, well, it's better if you just move on and do your things. And I said, well, that's what I want. So it was great. And then I went on my own, which is difficult.
Yeah, I know it is. What year did you finish your med school?
The medical school I finished in 1980.
1980.
Yes, and then I did it 5 years later on.
I was 12 years old then. But tell me, just looking at the medical school in 1980s, tell me a little about your experience there, because at that time, everything was paper, the classes and so on. People didn't have computers. We did not have cell phones. Life was very, very different. How was, let's say, your last year of med school? Tell us a little about the experience, because this is part of history. The school, especially med school, is very, very different probably today.
Oh, Allie's med school was way different than your med school.
Yes, it was. Yes, it was.
No, it is a totally different world. Before everything was, as you said, in papers, and you had to take notes in the classes to make sure that you got everything. We had the old style books that I don't think that they exist anymore.
They were like, if you have just this textbook, it was like, you needed a cart or something to carry them.
Yeah, an anatomy book, which is the Gray's Anatomy, which is, I don't know, 500 pages or
Oh,
something.
Grey's Anatomy is not the show. It's actual the book.
The book, yes, yes, yes. And it was a totally different story. And also, no dictation, no computers, no nothing. Everything was written. And when you had to do some kind of a homework or some kind of a special assignment, you have to sit there and with a typewriter, trying to type everything. So it was a different situation. Coming from Mexico to the United States and not being my primary language, English, I remember that I was a resident and my co-residents that were Americans, they were just picking up the phone at that time and dictating the report or the history and physicals or something like that. But I said, well, I don't know if the machine will understand my accent and understand my.
Did you ever try?
No, what I did is I tried it a couple of times and they were missing some words. So what I ended up doing for many, many months was to write down the history and physical in a piece of paper and then read it to the phone.
I see.
So,
No,
it was-
but I'm surprised that they have machine because I did started my residency in 1996. We did pick up the phone, we did dictate, but on the other side wasn't the machine. It was actually a person, a human that would listen to that and then type it for us. Was it a person that would type it for you or a machine?
I honestly don't know. I don't know if it was a service that Baylor College of
Yeah,
Medicine
yeah.
had, and it was just a recorder that was just
Yeah.
recording everything that I said, or if they had somebody there. But I saw all my core residents just
Yeah.
dictating in a minute and a half and then going on their own business. And I was taking 7, 10, 15 minutes to do my stuff because I just didn't
Yeah,
know how to do it. So it was different. But also they were great days because
Yeah.
medicine was amazing.
Yeah.
I mean, every day there were new things coming up. And then a funny kind of story is that when I decided that maybe plastic surgery is something that I need to explore, I noticed that I was missing a couple of credits to finish when I wanted to finish medical school. And I noticed that there was a course of plastic surgery in the American British Hospital in Mexico in the afternoons. And I said, well, that's it. I mean,
meant to be.
this is sent from God. And so I took it and I loved it. I mean, I really loved it so much that I became the assistant of the professor that was doing the course.
Mhm.
So since then, it's been 23 years, so those 20 something years that I've been doing this. And I just love it. I love plastic surgery. I love everything that it is related to it. It's artistic, it's beautiful. The patient's relations are great.
Mhm.
So it's just, as I said to you earlier, I would love to do plastic surgery till the end because I
Yeah.
don't want retirement or anything like that.
Do you remember your first plastic surgery case that you observed?
That I observed probably was a facelift because she used to do a lot of facelifts. She was the head of the department of plastic surgery at the American British Hospital. And I think that it was, well, I'm sure that it was a facelift. And then obviously the first one that I did as a resident, but fully myself, it was an abdominoplasty.
Mm.
Okay. How much has that changed from your first time doing it to now?
A lot. And I do tons of abdominoplasties. Is the procedure. Breast and abdomen is what I do the most. And it has changed a lot. I mean, I myself have changed a lot of the techniques in plastics. I developed a technique to do a regional block in the intercostal nerve, so we can block the pain after the procedure. And at that time, I did it just with lidocaine or silocaine, which was lasting 3-4 hours. But at least the patient went home very happily that he was not hurting.
Right.
Now there is a local anesthetic that lasts 72 hours.
Mhm.
So I do the same regional block that I published and with this medication. So that is a change.
Is that Exparel or what
Exparel,
medication
yes,
is it?
yes, Exparel, right. And then the technique of the crossing over of the muscles also I modified myself and I published a paper for that. So there are little things that we are doing. Liposuction was one of the major things that happened because when I finished my training, liposuction was already kind of going. And I actually was kind of trained by the guy that invented the liposuction in France,
Mhm.
Dr. Illouz. And the cannulas that we were using were huge. So it was
Yeah.
a lot of compression and a lot of pushing the tissue. Now 20 years later or 23 years later, we use a 2 and 3 millimeter cannula to do the procedure.
Well, now can't they do liposuction with like some type of like minimally invasive type thing where it's a small incision, like a hot
The
twist?
bipolar kind of thing, or bipolar unipolar, that burns the fat and then you can liquefy it and so on.
Correct. That is the Vaser technique that it is called. But this one, the cannulas, which are the
Yeah.
tubes that we're using it, they used to be 10, 12 millimeters in
Mhm.
diameter. Now, as I said, the biggest one that I use now is a 3 or 2
Yeah.
or 3.
Yeah.
So that is literally just like a needle going in and
Yeah.
out. And there are different kind of techniques now. There is a power assisted liposuction in which the machine just separates the fat before the Vaser melts it, as you
Yeah.
were saying. And since the cannulas are needles instead of cannulas, now we can go much more close to the skin and much
Yeah.
more close to the muscle. So their results are much better. We take a lot more fatty tissue.
Now, just listening to that, I think if my family listened to this podcast,
Yes.
There you
half
go.
of them will come and seek you out because I think, the plastic surgery has a value beyond just the medical side of it. It is for lots of people, they find themselves, their self-worth
For sure.
in going through the procedure and feeling good about who they are and what they are doing. And that is, I think, certainly in medicine, we want to help people in many different ways. But that is, I think, the value of the plastic surgeon. It truly helped the people that they have.
It can increase your confidence, and our society is so based on looks, where
Mhm.
you'll almost get valued more if you're more attractive or more thin or your body is more contoured. So of course, when these people have a low self-esteem, then they go and they have these procedures done and they look how they feel on the inside or look how they would prefer to look. They're going to be more confident, probably more successful too.
It is a fact. I mean, in some ways, we see patients all the time that they literally tell you, this surgery changed my life.
Yeah.
Because I was very concerned about my body. I didn't use any kind of clothing. I didn't ever use bathing suits because of the way I look. And then all of a sudden, I feel comfortable to use a bikini or to use whatever I want, any kind of clothing. And psychologically, that also makes a difference. It's like a push to feel that we are valued no matter what.
Mhm.
And obviously, the enhancement makes it a little
Yeah.
bit better.
And as you described, it's amazing how much technology have progressed. I can see it from my own, the career in neurosurgery. But I think the same amount of amazing new technology as well in plastic surgery has made a huge difference. Like you talked about that, your first, I think, the procedure you observed was a facelift.
Mhm.
Now, tell us a little about, how was facelift done then, and how is the facelift done now? What is comparing to first facelift that you observed to the one that you do now? What are the different?
The actual difference in the technique in some way it is the same in the sense of the incision and the way that we do the cut around the ear to try to hide it. The difference before is that at that time essentially they were doing just the pulling of the skin only. Then a few years later, there was another change in the technique, and we were actually doing a little pull of the muscle also, so it will be a little bit more long-lasting. And then what they call the SMAS, which is a layer of the tissue that goes right over the muscle, became super popular because without stitching or tying the muscle, you were tying this very thin layer that covers the muscle. You were able to pull it a lot more and then tie it more permanently than before. And since then, later on, they came with the endoscopic brow lifts and corona lifts, which is the forehead, and also some of the mid-face lifts like that, which is endoscopically. You make 2 or 3 little holes, just go with the scope and in fiber optic light, and you see with the camera what you're doing. So those have been the biggest change. Also, liposuction has made a difference because in the neck, especially, we do a lot of the blunt dissection to try to remove the fatty tissue that we have with the double chin with the liposuction. And then just after you remove the fat, the pull of the skin is much more strong.
How long that facelift that you watched like many years ago, How long did that take? How long did the patient stay in the hospital? And how long would that take now? How long would the patient stay in the hospital now?
Well, that is a very interesting question because medicine in that sense has changed a lot. I remember in my days as a resident of plastic surgery that even to do an eyelid surgery,
Mhm.
which was a blepharoplasty is the technical name, we admitted the patient the night before.
I
And
remember.
then the patient stay overnight, and then early in the morning, we did the surgery. The patient stayed that night also and left the following day. Now we do the same procedure. Now the patient comes in, just to say something, at 8 o'clock. We start 8:30, and by 10:15 or 10:30, they're on their way to go
Already
home.
home.
Why was the patient coming the night before? Just to be there early enough?
No, because we needed to do the H&P before, and it was the standard that you had to do all the lab work the night before, then do the surgery in the morning and stay there because again, that was the standard of care at that time. Some of the surgeons a few years later, they became smart. And then what they did is that they were admitting the patient in the morning, do the surgery in the afternoon, keep them overnight, and then let them go the following day. So they save one night.
Yeah.
Now we don't do that anymore, even with big procedures like Tommy talks, breast reductions, breast reconstructions of some kind, a nasal surgery, all that, the patient comes in the morning and goes in the afternoon.
Even breast jobs and things. Wow.
Yes,
I
yes.
would have thought that they have to stay overnight.
No, Tommy talks, we send them home the
Yeah.
same day. What they call the mommy makeover.
Mommy makeover?
Yeah.
Tell me about that.
The mommy makeover is essentially a combination of breast lift or a breast reduction and an abdominoplasty, which is called a Tommy talk. No?
Sometimes they do also the butt too, don't
Yeah,
they?
the gluteal injections. That's something that definitely was not available at that time.
It's so popular now.
Yes,
the
very,
BBL.
the
You
BBL.
explained. I want to know. Actually, I do nothing about mommy makeover or any of that. Do you mind to go over each of those things? And by the way, if you're listening to that, the place Dr. Varon is practicing is called First Street Surgical
First surgical.
in Houston. And we will make sure that the informations are attached to this podcast. So if you want to get a consultation, you know where to go. But tell us a little about this, whole this procedure. I want to know everything because my family is going to ask me, how is it done? What does it include? How much does it cost?
I'm going to tell you, I don't think they're going to ask you. I think they already know. You should ask them.
They probably will know. Yes, yes.
So go over it.
Well, the mommy makeover is, as I said, a combination of a breast lift or a breast reduction in which we make a little incision around the nipple and down. There are several techniques. At one time, many years ago, we had to kind of move the nipple into a different position. Now there are techniques that you don't have to remove or do anything like that with the nipple. But essentially what you do is lift up the tissue, or in patients that have a very larger breast, then reduce the size at the same time. Or on the contrary, patients that want their breast lift, but because of breastfeeding, the breast became very, very small, then we put on breast implant and do the lift at the same time. And then instead of saying, okay, well, that's the end of the operation, come another day, then we do the abdominoplasty at the same time.
Are they in general anesthesia? For
General
that?
anesthesia.
Yeah.
Yeah, it's a general anesthesia. In the abdominoplasty, we make what it's called a bikini line incision. We literally lift the tissue all the way to the edge of the ribs. And then the muscles that have been separated either because of gaining weight or mainly because of pregnancies, the abdominal muscles separate. It's called the recti muscles, which is the six-pack. And we bring those muscles together with a suture technique in which we cross them over or just approximate them, and depending on the surgeon, and put a few stitches there to hold him. And then we pull the skin as hard as we can.
Mhm.
So most of the stretch marks and all that goes away, but also now with the liposuction that we talked before, we remove the fatty tissue on the sides and the quote unquote love handles.
Mhm.
And then we take all that fatty tissue out and it gives you a beautiful contour. So that is combined the makeover.
Now, part of the skin is removed in that procedure, correct?
Correct. And many times, I mean, I have done tummy tucks in which I removed 20 pounds, 23 pounds of
Wow.
tissue. People that either lost a lot of weight or people that just were overweight and they couldn't do anything else. And the tissue was actually hanging over the genitals or over the thighs. And we cut it out with an abdominoplasty.
I can imagine how much better they will feel
Oh
just
my
about
gosh,
not
yeah.
having that excess tissue there.
Yeah, I got patients that said that in these particular examples that they said, well, I couldn't tie my shoes. I couldn't remove my socks because my belly was on the way. So when we do the procedure, this is a totally different change. Or the other people that do it just for cosmetic reasons exclusively, because they are in good shape, they have beautiful bodies, but they have just a lot of stretch marks or excess of skin because of their pregnancies. And we do the exact same procedure, but they look outstanding. One thing I can tell you, when we remove the first day the dressings after the surgery, we do it normally in the examining room, which has a mirror. And when the patients turn around and they see themselves, they say, oh my God, I mean, I will never, ever go back to what I was before.
I can just imagine how good that makes them feel. Like
Yes.
that is life-changing to go from being in a place where you have no confidence or you're feeling insecure about your body, and then all of a sudden you love your body. That would be so amazing.
Yeah.
Yes,
So
it is.
what else is part of that mommy makeover? Breast reduction, tummy tuck, but there's some.
Labioplasty.
That's usually the mommy makeover is really known for those two procedures combined. But now some patients want to take advantage of the anesthesia, don't have to have another anesthetic or taking time off, and then they add, as you said, either the BBL, which is a gluteal injection with your own fat, or the labioplasty, which is also part of the pregnancies and all that. The labia, which is part of the genitals in a woman, becomes different or becomes very large, or sometimes even interfering with sexual relations. And then we do this procedure to go ahead and trim it and bring it into what it was before. So that problem is corrected. With the BBL, is essentially with liposuction, we remove the fatty tissue either from the stomach or from the back. And it's processed in a special way, so it will be only fatty tissue without any blood or anything like that. And then with a blunt instrument, we re-inject it into the gluteal area.
And and this is practically a centrifuge, or what kind of process do you put that tissue before you re-inject them back?
There are different techniques that the doctor obviously makes a preference of which one it is the one they want. Some of them, they take the fatty tissue out and they do use a centrifuge, and they centrifuge the fatty tissue so the blood will separate, and then the oil of the fat will separate and inject that. Some of them, there's a little device in which you can actually just wash it with some antibiotic solutions, and there is a filter underneath, and the blood and the oil goes down into the bottom of the bottle, and the fatty tissue stays up there, and that's what we use. When we started doing BBL, so gluteal injections, so both injections, like some people now say that it's the real name. We used to use just big syringes and inject it through a small little
What
cannula.
volume, if I may ask?
The average is about probably between 700 to 1,000 cc's.
So this is
It's big.
major.
Yeah,
This
it's
is major amount. This is not just
Haven't you seen Kim K?
oh, well, I guess I have
So
not.
action.
I guess I have not. Okay.
Yes, but now there is another technique in which is a little bit better, in my opinion, and that's what I use, because with these 2 or 3 millimeter cannulas, we aspirate the tissue. It goes through bottles in which we process with the antibiotic solutions. We let it filter, and then through the same hose, it goes back again into the same hole, and with the same small cannula, we re-inject it into those areas.
Wow.
So the human does not touch the blood or anything
Which
like
is
that.
important, because every time it leaves the system, it has more chance having contaminant introduced to the tissue. That
Sure.
is, I think I can imagine, what would be the rate of infection if something like that? No, let's make it even better. Without this technology, because I'm a technology lover,
I see.
and I see what that does for human being. Without this technology, what used to be the rate of infection in liposuction, let's say 10 years, 20 years ago versus now?
It is definitely a change. Fortunately, it hasn't been too much of an infection process or an infection problem, because of the fact that we all do it through a small little opening. So in the past, probably, we don't know the exact numbers, but it was probably maybe the average 3 to 5% of the patients. And it was not a severe infection. It was mainly just like a cellulite or just a little bit of cellulitis around the incision. These days, the entire in medical community uses different kind of things. The hospital's using a lot of different instruments, a different air ventilation and all that. So I would think that now probably it's much less than 1% of the cases.
That's significant. That's by magnitude less.
Yes, it's very significant. Now, the major thing or one thing to consider is that it is published, and that is a fact that in the newspapers and in magazines, some of the patients get a little worried about doing gluteal injections because from all the procedures that we do in plastic surgery, that is the one that has a little bit more chances of complications.
I don't know how true this is. It was told to me by another plastic surgeon because I asked him about the BBLs and like the high risk and stuff. And he said that it's not a risk because of the plastic surgeon. He said a lot of these patients are going to a cosmetic surgeon. Is that true?
Yes, unfortunately, what happens is that with the insurance companies paying less and less for the medical procedures in general, not only plastics, but also general surgery, neurosurgery, cardiology, etc., everything, then some of the non-plastic surgeons are starting to do procedures. And we have issues with gynecologists and general surgeons and even dermatologists that are doing these procedures like that. And I mean, we know that they have been some issues, of course, but we don't know the exact percentage in comparison between a plastic surgeon and one of these doctors. Obviously, to be a plastic surgeon, you have to have at least 5 to 7 years of training. To do dermatology is normally 3 or 4, and to be a general surgeon about 4 or 5, but in a different field. So it is hard. So one day to, instead of doing a gallbladder surgery, to start doing a BBL or something like that.
Right.
And unfortunately, that is a problem that we have to fight every day. Now, there are people that are ENTs or other specialties, and they get trained to become capable and to do these cases, and that is fine. But unfortunately, as you said, some non-surgeons are doing it, and that's when it really goes up.
Now, to clarify, cosmetic surgeons are non-plastic surgeons that have different training, either surgical or non-surgical, but then they do additional courses and classes to be able to do those procedures. Some of them are advanced. Is that correct?
Yeah, it is correct. I mean, they are usually either general surgeons, gynecologists, and mainly ENT. Those are the 3 primary specialties, and now some dermatologists. And there is a board of cosmetic surgery, and these people, after they are board certified in their specialty, let's say dermatology, plastic, general surgery, or whatever, they take a year fellowship in an accredited facility to do the cases. It's not the 5 years of training that we have to do, but at least if you count that year plus what they had before, they do the procedures.
Can non-surgeon as well do that fellowship, or is it specifically limited to surgeon?
No, it's limited to a surgeon, and it has to be a surgical specialty. So it will have to be, as I said, ENT, general surgery, gynecologist that they do.
Neurosurgeon?
Neurosurgeon,
No,
we will
I'm
invite
not-
you because you are in surgery.
Not interested. Thank you. But I admire that the end results, that how you are able to really reshape not only the outside, but through the outside, the inside, and self-confidence, as you were referring, of a
Yes.
patient. That makes a huge difference in their life.
And do you ever do like injections? I've seen people get nose injections. I know this girl who had a really large bump on her nose, and somehow they did an injection and like made the bump go away.
Right, it's what they call a filler, which there are several of them. There are like 3 or 4 different brands. And obviously the company that makes them, they have advertising in all these magazines about Restylane and collagen and Juvederm and Radius and many of them, just like Botox, which is another thing that is very popular. So essentially it's different kind of materials or substances that you inject into the area, either to fill the lines in here, or the lines that we have here in the top of the nose, or as you said, now they are calling the liquid rhinoplasties, and they inject that one. Those ones, most of the plastic surgeons don't recommend. They are usually done more by dermatologists or other specialties, because of the fact that you're injecting a filler that it has a certain life. So if you are going to inject a solution that is going to correct the bump in the case that you're telling me, but you know that it's gonna be 18 months, 12 months or something like that. Then it's like, okay, what happens later on?
Mhm.
And most of the plastic surgeons say, well, if you really want a long-term effect, it's much better to do the procedure than those ones. But I have to admit that they are very, very common with dermatologists or the quote unquote cosmeticians, which are not doctors at all,
Yeah.
or
Yeah, 'cause
estheticians.
a PA can do that.
Yes, yes, yes.
What is the most commonly performed plastic surgery by plastic surgeons?
It used to be in the past a breast augmentation, but now there is we don't have, or I don't know about any statistics that are already out that confirms it, but I think that the abdominoplasty is now becoming one of the very top ones.
And I remember when I was doing my intern year in Dartmouth Hitchcock Hospital in New Hampshire, I was amazed about at that time, that is 23 years ago. We had a patient that we used the laser to burn the surface of the skin. And I had to watch that patient in the ICU for a while
Oh,
because we had to, I don't know why, you tell me, but because we had to keep the face moist and everything and covered because it was, we were producing like a first degree burn of the skin. And I know that you can do it with chemicals or laser.
correct.
So that then the new skin comes back up. And I was amazed when I, looked at that patient later on.
My
Like, what the-
facialist does something like that
Yeah.
at like a much lower level,
Yeah.
but she does something that like burns off some of your skin and then it peels for like the
No,
next week it
but-
starts peeling off.
But that was really massive. And the idea was that you have to watch them very closely, make sure that, if you don't do it the right way, you're going to create a scar.
Correct.
And so tell us about that.
Yeah,
What-
they
what
are
do you know about
essentially what they call it laser peels or chemical peels. And they're in all practical purposes, three different ones. They're very superficial peels, which are done usually with glycolic acid, which is what you were describing with your esthetician, which is a very superficial peel. It works. There's no question about it that it works because you're doing a very superficial burn of the skin and taking away some of the layers of the skin. The second one is a medium peel, which normally is done with a solution that is called trichloroacetic acid, which is a stronger acid than the previous one. And that one is also one that you recover relatively quick. It's usually done in the office with a little bit of sedation or just sometimes with pain medication. But it burns the skin and layers of the skin start coming out. What Dr. Abbasi is referring to are the laser or the deep chemical peels that are done with phenol. And that actually is a very much deeper peel than the other ones. And that's why they are the deep peels. But the results are amazing. I mean, it is impressive. I'm like very much doing chemical peels, and I always liked it because the patients are so happy for so many years. You just have to select the right person.
Yeah. And I think in that person, probably that was because it was a deep kind of peel. And it's like a burn. It's like a very painful thing. Patient has to be sedated. And that patient was sedated, and it was needed really a lot of care to keep the skin moist. And you don't want to sedate them too much, but they have to be monitored. So yeah, I was as well, a little surprised that that patient, when I was actually in the ICU, I don't recall for a night or for 2 nights, but
I'm surprised that he was actually even hospitalized because we normally do it. You're correct. I mean, it requires a lot of care because you need to keep something moist and a little bit of spray with water.
this is 23 years ago.
But that's it. Yeah, maybe it was something, or maybe the patient had some little issues. One of the potential problems that you can have with phenol are cardiac problems. So that's why we do these procedures in the OR instead of in the office, because we monitor the heart all the time. So probably in that case was somebody that had a little issue with the heart, and then for preventive reasons, they kept it over there in ICU. Most of the times they go home. Definitely to do the procedure, we recommend either IV sedation or maybe even a general, because it burns, definitely. But then the patient or the family can help the patient at home just to keep moisture there with a spray bottle. And then just now we have several things, Aquaphor and a few other solutions that you can put on.
So this procedure, the facial peel and so on, you said there are 3 levels, and you said there is a selection criteria or selection. You have to choose the right patient for. What do you think that the superficial, medium, deep peel? How do you choose them? How do you
They-
recommend to patient which one to
The
get?
glycolic peel, which is the superficial peel, is done just to kind of freshen up the skin a little bit. And as I said, that is really not a very deep procedure or any deep layer procedure. So they do well. And that is usually for younger people, and it's just like a refreshing of the skin. There are another ones which will be more the medium size or the medium kind peel, the ones that they actually have some damage already by the sun, or that they have this deep dark pigmentations that is called melasma. And then you need something that will be deeper than the other one, because other ones it will not take care of these issues. And in most of the cases, either eliminates it or at least even improves them significantly. The third one, which is a phenol peel, is for people that had a lot of sun damage. It doesn't matter if they have the loosest skin or not. What it matters is that they will have a lot of wrinkling and a lot of dry skin and deep lines and things like that. That the chemical peel deep, the phenol peel, works amazing because it takes away several layers of your skin.
How long does it take for the new skin after deep peel to come back?
Normally, the skin regenerates in about 10 days as a general rule. Now, you are red and you have some redness for several weeks after that, sometimes 4, 5, 6 weeks. So we always recommend a sunblock at all times, and preferably to use a baseball cap or some kind of a hat in order to prevent the sun, because that also burns when the sun hits your face. That is burning.
But either way, you should be wearing sunblock every day.
Yeah, I agree. Sunblock is super important. It has been proven over and over that the skin damage is the worst in people that have exposure to the sun.
Especially if you're Caucasian and you don't have enough melanin and
Yes,
so on.
yes.
And if you're from a Middle East, that you go in there under sun and you turn totally dark. I
You
think,
can still get sun damage.
yeah, but the Lord gave us our natural sun protection.
Yeah, but
It
you can still get
it
it.
did, but on the other hand, she's correct in the sense that it is recommended to use
Darn it.
Thank you.
sunblock.
Finally, thank you.
No, you got a very valid point, and what you said is true, but everybody would recommend a sunblock. And that's why most of the products in the last 10 years or so, beauty products, all of them, all the beauty creams, quote unquote, all of them have
Sunblock,
some kind of a sunblocker.
So there's something I absolutely need to ask a plastic surgeon. What is the most performed plastic surgery for men?
For men, usually it is the eyelids or the noses, or at least in my practice. Most of the patients, like occasionally there is a patient that the breast grows a little bit, that is called gynecomastia. And then we do either liposuction or the removal of the gland. And also some liposuction of the quote unquote love handles, which we develop also down here. So that is true. But I would say that probably the lids, the eyelids, as well as the nose are the two most common in men.
What type of surgeon does hair plugs, or is it done by a surgeon?
Plastic surgeons do it, and some dermatologists do it. And once you
Well, when you're going a little bit bald, you explain it.
Yeah, when you're losing some hair, and it can happen in women also, and also it doesn't happen only in the male pattern baldness, but it happens also in other different areas in the head. They come, and then in my time when I was doing my training, we literally cut a strip of hair from the back, and then we pull hair by hair, and then we not injected, but position it in the scalp of the area that you don't have the hair.
Wow.
And it's a very, very,
Tedious.
very, very tedious procedure. Yeah, it takes several hours. And it is, I mean, very good because the hair grows back again in those areas, and it looks
Yeah.
good.
Is it a machine that does it? Or do you
Now
have to
it
do-
is.
Oh.
That's because you are too smart.
He's a technology guy.
He's too smart. Now that's what I was going to say. Now it has changed a lot, and then they had now different thing in which there was a little machine that separated him just by kind of cutting it. And now the latest one is a laser machine. It's like a chair that you sit down, and they take the strip, and then the machine goes pop, 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 and
But
says,
how does, laser make a hole and then another mechanical machine put the
Normally, it's not the whole, we actually take the strip, separate the follicles, and then it's almost like a thick needle that you just push it into
Oh, I see.
into the area. And when you finish a hair transplant procedure, it doesn't look that great because you have just hair
I've
coming out
seen them
there.
I've seen when we were in the Turkish airport, I saw a lot of people with their hair. They had just gotten it done. It looks a little bit scabbed.
Oh, because people go to Turkey to get
I
that done.
think I'm pretty sure Turkey is one of the top places to go.
It
for that.
is. It is. We don't understand exactly what happened, but Turkey became one of the top places to have hair transplants.
Wow.
Apparently, they do it very well, and they do it for much less money than it will be in the United States or in other places.
Turkey is known for a lot of medical tourism, like veneers and hair transplants, nose jobs, from what I've heard.
Yeah, they have very good plastic surgeons in
Yeah.
Turkey, with no question about it.
So what is if you say there are three things that in the future of plastic surgery that you are personally excited about in the next 5 to 10 years, or even maybe in the next 3 to 5 years, what do you think that, first of all, what do you think that's coming in the next few years? But beyond that, what do you like to see coming in the next 5 to 10 years?
I think that what it is coming are essentially just improvements or modifications to the procedures that we have now. Unfortunately, I don't see that there will be a way to do a tummy tuck with laparoscopic procedures or anything like that. But definitely, we are doing now the laparoscopic, when it's not laparoscopic procedures anywhere else, because laparoscopic is in the abdomen, but the endoscopic procedures for the brow lifts and for what is called corona lift, which moves the entire thing, that I think that is changing a lot. And suture material also is something that has changed a lot. There are some sutures now that they have much less reaction, so the scars are better. And probably something else with laser. I mean, maybe some of these pills that we were talking about, initially we were using CO2 lasers, and now we use different kinds that produce the kind of the same effect, but with less trauma. So the way that I see plastic changing is just with this exparel injection that we were talking about, changes that will make the patient recover faster and with much less pain than it was before.
Excellent. Wow. Go ahead.
Yeah, I have a question about a more it's like a newer thing that people are doing. They call it Barbie Botox. It's Botox in your traps to make your neck look more slim and your shoulders look lower. And then it's supposed to also relieve tension. Do you have any opinion on that?
Well, it hasn't been that popular because it's something relatively new, and probably as a result of the movie Barbie.
No one in Minnesota, actually only one person that I know of in Minnesota is doing that.
Right. It's not in the field of plastic surgery, it's not popular, and I don't think that it will, because we just don't have a long-term information of what is going to happen. And we plastic surgeons try to be very conservative in that sense and make sure that we are not going to do anything that potentially could have a problem for the patient. So with all those newer techniques that are not proven, we prefer not to do it. There are some other specialists that they inject the Botox also in the neck to take care of the two lines that we have there. Yeah. But there have been some reports of people that then they have problems swallowing, or that they have problems with the movement of the lips. So because of that, we stayed away. But a lot of other specialists, like the estheticians and dermatologists and people like that, do it, and with not major problems, so with no problems at all in their eyes. But it's not a proven plastic surgical procedure, so we stay away.
Of course.
What percentage of the work you do in your practice is covered by insurance, and what percentage it is not? What would you say?
The only thing that insurance will cover for plastic surgery is essentially if it is medically necessary. And I do, because I like that field. I do a lot of patients that have burns, so that they have infections, so that they have scars, and those areas are medically necessary. And they should be covered by the insurance, even when the insurance sometimes give you a hard time and they deny it, which is totally wrong. and somebody will need to look into it. It's totally wrong that an insurance company will decide if it is medically necessary or not when it is a burn or when it's an infection or it is a scar. But unfortunately, that happens. So what is happening lately is that people are combining procedures. Like if you're going to have, for an example, a hernia repair, some patients say, well, you know, I don't want to go to a general surgeon and have my umbilical hernia or my ventral hernia repair because I was having this thought for a long time that I want to have a tummy tuck. So can you do it combined? And surgeons like me that had the training in general surgery before, we can do it with no problem. And you save the patient one anesthetic, one recovery time, one significant amount of money. So those are the cases that they cover. They obviously cover nasal surgery because you have breathing problems if they consider it necessary. And they cover also some hand surgery like tendons, carpal tunnels, trigger fingers, that kind of thing.
I wonder if insurance will ever like, and this is so far-fetched, but imagine if you had really an insecure moment and it was affecting your work and your personal life. So you talk to your therapist, and then what if your therapist could recommend that and then insurance would cover it at some point? Do you ever see that happening?
We do hear a lot of patients that say that they have problems with depression or with anxiety or that kind of thing because of not the defects, but the problems that they think they have. But unfortunately, in the eyes of the insurance company, that is not a medically necessary procedure. It is known and that the insurance company will always find a way to deny a procedure every single time.
So primary objective of insurance company is not providing care, is finding a reason to deny the care, unfortunately.
Correct. And it is very obvious that that's why the insurance company keep making tremendous amount of money to most of the cities that you go through and you see a big building is usually a United Healthcare, a Aetna, Cigna, Prudential, because they are making the money because they try, as you said, to deny as many surgeries as they can, and then also to pay less and less and less to the physicians as well as to the hospital.
Yeah. Unfortunate, but unfortunately the reality.
In common.
Yeah.
It's common amongst like all the different surgical fields.
Well, I think this is going to be one of our most reviewed podcasts because the subject that we are discussing here is such a hot topic, especially among your female age group that are interested in this topic. What else do we need to talk about, Amanda?
There's just so many common things right now on social media, so many procedures that celebrities talk about or controversies like, did she get this done? Did she not get this done? Like right now, something really big on social media, you might not know, but people are kind of up in the air saying that Putin recently got a facelift. I know that he was going through some medical issues and stuff, and he came back looking really good.
No,
so
I haven't seen a picture of it.
Yeah, maybe
but I'm gonna look for one.
But yeah, that's interesting to me is when celebrities look one way and then come back on the red carpet looking another way, but deny that they had any surgery done or deny they had any treatments. I don't like that part of plastic surgery. I think plastic surgery is amazing and so helpful, but we should always be honest about what we're getting done. So then we can make other people feel comfortable about what they're feeling insecure about.
Well, in the ideal world, what you said is exactly what it should be. Unfortunately, a lot of our patients, they feel that way and they actually tell you, go and see Dr. Veron, go and see Dr. whatever, because we definitely got a great result and I want to tell that I had the surgery. Unfortunately, I had another group of patients, they don't. They want to keep it private and they want to hear, oh, how good you look, but never say I had plastic surgery. And then they come up with these things about I was dieting or I've been resting.
Went to a retreat.
Exactly.
It's understandable though.
Yes. I mean, there's no way, no wrong way or right way of what is happening, but most of the time and in the last many years, plastic surgery now has been so well accepted that it is becoming more common that people say, well, no, I had a breast surgery or I have an abdominoplasty or I had liposuction, and they do very, very well.
And it is in a way like online dating. It used to be that you always try to hide it,
Yeah.
but now it's just so normal.
Yeah, I think these days plastic surgery is way
Yes.
more normal and accepted.
Yeah, I
Yeah.
agree.
The celebrities issue is that you see some of them that look really good, and you see some that change so much
I know.
that you said, no, that is not the same person. How beautiful she was compared to now. And that is one thing that I tell the patients that I very, very strongly believe in. You have to do the procedures in such a way that they will look natural. When you try to go to the other side and you try to do too much, instead of doing a favor to the patient, you are doing something that is harm, because the patient goes out and she feels uncomfortable or he feels uncomfortable. And at the same time, it's just not the same person, and that is wrong.
Yeah, like Mickey Rourke.
Yes. Mhm.
That's one example. He was such a very attractive, young actor, and all the plastic surgeon, there is really nothing natural anymore looking in that. And I totally get where you're going.
Yeah, I always tell the patients, and I strongly believe on that. For me, I want the patient, either her or him, to go to a party or whatever, and that they say, hey, you look so great, and you look amazing, everything is okay, but that they will not know exactly what is happening. There's just a beautiful look. I will hate that the same person will go to the same party and they say, hey, you got a nose job, or you got a tummy tuck, or you got a gluteal injection, because that is not what we want. I mean, that means that it is maybe a little bit exaggerated or too much.
Mhm.
And instead of helping, you are not helping.
Do the patient come to you and try to push you to do more?
Yes, we have two kinds of patients. The one that they really need the procedure and they say, well, but in the gluteal injections, for example, I want large and I want really, really large. And I tell the patient, then you're looking at the wrong surgeon, because I will not do that. I know other surgeons that will do it. I'll be happy to refer you, or you can look it up on your own, but I don't do that.
So you're an artist. You love your art. You
I
don't
love-
want to destroy the canvas.
No. I definitely do that. And then some other patients that come over and they say they're 35 years old and they say, well, I need a facelift, or they are 125 pounds in great shape because they exercise, they diet, they take care of themselves. And they say, well, I want a tummy tuck because they have minimal amount. So I tell them, I'm sorry, but if I don't do unnecessary surgery, so if you don't need this procedure, I'm not going to tell you that I do it. And I get criticized by some of my friends, plastic surgeons, because one of them especially tells me all the time, Jacob, that is a huge mistake, because if a patient comes to you saying that they are concerned about one part of the body and they want surgery and you don't do it, the only thing that is going to happen is that they will go the following day to see somebody else that will do it, and you lose a patient. And I tell this friend of mine, I say, something, perfectly fine. I want to lose the patient. I don't want to keep the patient if I know in my heart that I'm doing something that is unnecessary.
Or you also could have just made them realize, yeah, it's not as bad as I thought. Maybe I'm having some type of body dysmorphic thing going on. So maybe you do give them the confidence and make them realize they don't need the procedure.
Some of them, but definitely some of them, I'm sure, by coming to you and being honest to them, I think that the best we can be to our patients, being honest to them.
Yeah, another thing that I don't do, and it is relatively common because the patients tell me that it is, that ex-patient goes to see a doctor for, let's say, a breast surgery. And when they're in the consultation, the surgeon says, well, have you ever thought about having your eyelids or maybe something in your nose? I understand. I don't agree, but I understand why they do it, because they want to get another surgery out of the patient. But I think that is absolutely
It's a
not
car
right.
shop
If someone did that
mentality.
to me, that would like destroy my whole day.
That's what I tell them exactly to my friends or the doctors or the patients or to everybody. Once you go to a certain doctor for one reason and the doctor tells you that you have some issues with other part, you're putting a seed in their brain that they didn't have before. And that is much more damaging than anything that you can do.
They're already vulnerable when they come in your office.
I think that speak highly from your ethic.
Thank you.
But at the
Thank
end
you
of
so
the
much.
day, we surgeons, we are there here to help the patient. And I think one of the worst things you can do to the patient is exactly place that seed that something else is as well wrong with
Right.
you.
Right.
Wow, this was good. This
It's a
was-
fascinating specialty.
Yeah,
with no
this is,
question
I
about it.
this is one of our best, the essence of medicine.
Yeah, I agree.
Yeah,
Yeah, I
and-
like this
So
episode.
thank you for the opportunity. It's
Wow.
been
Cool.
amazing. It
No,
has been
thank
an
you. Having
amazing
an
afternoon.
expert, having an expert like you and it's sharing this knowledge as well with our fan and with our viewers and so on. I think this was amazing.
Well, it is exactly the same thing that happened to me after I saw you doing surgeries today. I mean, I see neurosurgeons that do back surgery, but when I saw you, I said, oh my God, this is out of the world. I mean, it is a different technique, it's different instruments, it's precise, it's guided, it's just an amazing surgery. So I thank you for the day. I thank you for the wonderful time that I used to have this day with you and also from the learning, because I didn't know that there were different approaches to these spine surgeries that you're doing. And now I learned that they can, thanks to you.
Well, I'm as well amazed about your expertise. So it's really mutually, the admiration is mutual. Well, Amanda, it's time again.
Thank you guys for watching. This was Essence of Medicine. I'm Amanda Armagost.
And we have Dr. Veron, please.
Thank you so much. It was a great pleasure to be here and have the opportunity to talk with you and to have you as a listener. So hopefully it will happen again in the future because it was enjoyable.
Absolutely. And I'm Dr. Abbasi for Essence. And if you're looking for an expert in plastic surgery, if you're in Houston or not, we will put the information of Dr. Veron in our comment section.
Yep.
So, and